Hey everyone, thanks for coming today. I know there are some concerns about how our meetings are being handled, and so let's take some time and try and get to the bottom of our issue. Our goal for this meeting is to address all issues you seem to be having with how I'm running the unit meetings.
Thanks, Carrie. Thanks. I'd like to add a couple things before we get started. You as nurses on the floor have asked to meet with Carrie and I because you are concerned, correct?
Right.
Right? First of all, I'd like to let you guys know that we're very thankful and we appreciate your input. This is only going to help us pretty much make sure that our unit runs much, much smoother than it already is, as well as our group meetings. So you've already stated in writing to Carrie and I that you have some concerns and we're not properly addressing these issues in these meetings. So we're going to reorganize the way that we run these meetings, and in hopes of solving this problem, I want to establish a few ground rules, or I want to establish some norms for future meetings that we have. One of them is I want to make sure that we have a solid respect for each other. I think that's very important because in past meetings we have not had solid respect for each other. So let's start off with that. I also want to make sure everyone arrives on time. That would definitely help facilitate the meeting, how it runs. So that's the second most important thing. Again, we need to also speak one at a time. James, how nice to see you. How nice to see you. So happy you're here. So happy you're here.
I just had to address some issues, so sorry.
Well, we're very happy to see you here at the meeting today.
Thank you. I'm happy to be here.
That's good. Again, we want to speak one at a time, and we want to listen intently. It's okay. We want to speak one at a time, and we want to listen attentively to what each other has to say. And we want to help each other in resolving these conflicts that we have, because everyone's input really is equal on the subject at hand. So, Carrie, did you want to say something? Or?
Well, thanks, Alex. I think you're right about our group meetings and setting some norms. I realize that some issues have been arisen due to general nature of our meetings, so I would like to address the group and see, what specific concerns that everyone has about our meetings and how we can potentially work on them and change them for further meetings to make everyone as happy as we possibly can.
Okay, well on that note, I think I will start because I think that at the end of shifts, things aren't being done appropriately during every shift. And, I come in the morning and, patients aren't bathed and their beds are soiled, specifically after Amanda's shift, but
Right.
I guess
Well, let's not point
irrelevant.
fingers here. Let's not point fingers here because
right.
it not necessarily is Amanda.
Right,
But sometimes it is.
right. Well, that would just be my issue is that, I come in and I'm doing my job and her job, so that's just my main problem.
So you feel like you're doing double duty? You're doing two shifts
Right.
work in one shift?
Yeah.
Okay. And you say this is all Amanda. I mean, guys, we work as a group. We are a team. So we don't want to put blame on anybody as much as possible. We're a collective group. We need to work together better.
Okay.
I think maybe something that could help with that is if, I know as far as scheduling goes, if everything's so tight, but maybe if we even had like a bit of an overlap, between shifts, that way that we could have more time with the other person.
That's a really great idea.
Well, you know already that your shifts are 8 to 10 hour shifts, and you're in 7 to 7, and the person actually is supposed to be in a half hour before the shift ends, specifically for that reason.
But that doesn't always happen.
And that raises the next issue,
Which is?
the report. That's where I think we're missing the communication because the reports are brief, they're not saying everything that happened during the shift. So if, say for example, Amanda didn't get a chance to bathe the patient, then she could let me know before my shift that, hey, just so you know, patient in room 2's bed is soiled, it will need to be changed. I feel like if the communication was there, I wouldn't be so upset about it.
Tiffany, you got anything to say about this?
Yeah, I agree with Angela.
I agree with me too.
I think an issue that I am seeing has to do specifically with dressing changes. I'll go in to give my patient a dressing change and I'll have no materials that I need. for that dressing change, and I just feel that, as Angelia said, the night nurse or whoever, the morning nurse, should be refilling that and restocking so that the next nurse on can have her supplies.
That's definitely another issue.
I think maybe what would be cool is like if we could establish a new protocol, so how that transition, those things, like things that aren't being stocked, maybe that could be a part of that half-hour transition that we could maybe make sure happens from now on, and have maybe a physical checklist of everything we could
Yeah.
get done kind
Yeah,
of
that'd
across
be
the
good.
board.
Make
Just
sure
throwing it
everything's
out there,
there.
random idea, but
It's a great idea.
I agree.
I also agree, that's a good idea. What do you think, Carrie?
I do agree, absolutely. I think that we need to have, if everyone's issue is reporting, then maybe we should go back and talk about what exactly needs to be given in a report, what everyone would like to have, and make sure that they know about what Angelia was saying about bathing people, and what Amanda's saying, right before your shift ends, maybe just check over your room, make sure there's supplies in there, knowing that maybe a tubing needs to be changed, a dressing needs to be changed, certain things need to be done, so those materials should be in there for the next shift, and then also, reporting, hey, sorry, I was really busy last night, I couldn't get to it, I think that goes along with respect and communication of the entire unit, and how, I think all of us want respect, and I think we all should be working on our communication skills, and myself included. That's why we're having this meeting today about what we can change and make better.
I think maybe part of that too, we have all these floor meetings all the time, and we've kind of addressed these specific issues in so many ways, that it's almost like at this point, no one's listening anymore, because the things just aren't actually getting addressed within the meetings.
Right, nothing's
So-
getting accomplished.
So maybe within those meetings, we could be more specific in a certain way, or some way that you actually know what's going on.
How exactly are the shift changes unsteady? How are the employees not reporting correctly? What kind of things are we missing in the reports?
They're just really brief. I think a lot of times they'll just say, oh, everything was good. And, oh,
Or I had a diabetic patient that wasn't noted as being diabetic.
right, latex allergies. There's specific little things, well, that's not little, but there's specific things like that. But even just what happened on their shift isn't coming over into the following shift. So it's like you're coming into a whole new day of different patients, and some of them have been there for days, weeks, and you still don't know anything about them.
Have you checked the charting? Have you checked the charting to make sure that they've been properly taking care of these patients?
I think charting too is also brief sometimes, they're not putting, they may put they're not putting exactly what they're doing, I think is just what is missing.
And I think part of my issue is, that ultimately, this meeting is because our other meetings haven't, changed anything. We're still running into the same issues. So I guess my concern would be of ways for us to come up with having those meetings run in a better way, because nothing seems to be getting done. No change is coming out of us constantly always talking about the same things in the group meetings over and over again. And no, it's just too vague, I feel.
Well, previously, what I was saying that I did want to establish these group norms, and one of those norms were for people to arrive on time, that way we properly could facilitate the meetings. And again, you were late, this is like the third or fourth time, so that's one of the things that would help these meetings kind of...
Well, this is our first meeting. We've never really had a norm for this meeting, so, but going forward, in our group meetings, I would more than willing to be on time for those once we establish
Well, and I
that
also think
in our hall meetings, not these
once we
meetings.
do meet, my issue may have been a week ago, and I don't fully remember a week ago what my issue was. So coming to the meeting, I may not have issues today, but a week ago I did, and maybe a week later. So maybe if they were more frequent, I would remember. A lot goes on in a day. We're a busy floor, so maybe if they were more frequent, then we could all...
Maybe we should
So-
make a system.
So what if we implemented a way of you being able to write down your concerns and put them into I guess what you could call a suggestion box?
Yeah.
And those will be used for our group meetings, and we
Okay.
can establish that they have to be in by a certain time so that I have time to go over them, and then I can look at them, and I can lay out an entire meeting in a, a schedule for a meeting. Basically, we're gonna talk about, you know, situation A, situation B, situation C, and go from there, and so that everyone's concerns are addressed in the one meeting, and then that way you don't have to remember, you can write it down that day.
That
And put it
sounds
in the
good.
box, and then we can go from there. So Tiffany, I realize that you haven't said much in this meeting, and I was wondering if you have any concerns, or is there a reason that you're not sharing anything? Is anything that you,
Well, I guess I just feel really intimidated with everyone being here, and I don't deal with conflict well, so I guess I just.
Oh, excuse
agree
me.
with-
Sorry, I just have to really take this. I'll be right back. Hey.
Yeah, it's just a little
Mhm.
rude.
So rude.
Yeah.
Yeah, he makes me uncomfortable.
Is that all that makes you uncomfortable? He's
So
the
what's
only
going
one that
on?
Makes you uncomfortable?
No, I'm gonna be busy later.
This is a much smaller group now.
Yeah.
So you can talk more, you know, and not be so intimidated, right?
Yeah, I'm gonna be. Okay.
back to our initial problems that we're having in this unit currently, and with our,
Right,
and with
sorry.
our group meetings.
Sorry about
but
that. My bad.
I'd like to raise just another issue. With the suggestion boxes, I would, as we had mentioned, like them to stay anonymous. One of my issues, I don't think it's quite fair that one person is pinpointed in these meetings.
Like you.
Well, if that one person always did their job,
Well, I
we
don't.
wouldn't have to do
Whoa,
that.
whoa, I don't think we should be pointing fingers regardless.
But I
think
mean,
if
it
it's a general
is what
issue.
it is.
If the shoe fits, I mean, if you come in on your
Wear it.
shift.
My overall purpose to this is just with the suggestion box, I think if everybody agrees, we should keep it anonymous.
We agreed on anonymous.
Yes, we did agree on anonymous.
Anonymous,
And
but-
we will most definitely keep it anonymous, yes.
Good.
Yes, I don't,
Then I really agree with.
But the meetings will probably be more specific, and your name will probably be brought up again, just so you're aware.
now guys, I think that we have to, yes, if the suggestion box is remaining anonymous, then the meetings also should be remaining anonymous, because as much as, we'll use the example that if Amanda's doing something wrong, just as much as maybe Angelia is doing something else wrong that has not been brought up in this particular meeting, then I think that we need to keep a level playing field when it comes to everybody. We all
I
don't
can
do
see
things
what you're
perfectly. I certainly don't as a nurse manager. Alex doesn't as a nurse leader. And, you know, we all make mistakes, and we need to keep that, you know, that's the only way we're gonna resolve a conflict, is by not putting
Okay.
blame. It's gonna be a group effort.
We need to make sure that we're striving to be as respectful as we possibly can towards each other. So again, we need to run a smooth unit, and that's the only way it's gonna happen if we all respect each other, and if we all just do our jobs, and that way we can alleviate any future problems that we might have. How often should we have these meetings, you think? Carrie, you're the leader of our group, so how often do you think we should have these meetings?
I think once a week is appropriate, as long as we utilize the suggestion box that we just discussed, and everyone has their suggestions in the box about 24 hours prior to a meeting. That way, like I said, I have time to go over them and print out a nice little discussion sheet for everybody to look at and know what we're going to be discussing that day. So I think once a week is appropriate. How does everyone else feel
I
about
think
that?
that will be better than the once a month that, we've been having.
Yeah.
Then
I
that
think
way,
everyone will get their ideas across.
yeah, issues get addressed more quickly, more frequently, and more efficiently.
Yeah.
I agree.
How are we going to make sure that these conflicts are actually resolved? Are we actually going to go around and establish new rules on the unit? Is that what you guys like? Would you like different rules on the unit?
Well, I
or-
think James' suggestion about actually having like a checklist before the shift change, so the reports are more detailed. We may even have to go over what really needs to be in a chart, because even those are being too brief. So I think a checklist would be a really great way to get rid of, the lack of materials and stuff like that.
And then also within the weekly meetings that we have, we can move from the somewhat unstructured, very vague meetings that we've been having to now addressing, all the specific issues that, well, all the pertinent ones that are maybe in the suggestion box every week, from the top point out.
Well, I can certainly take everyone's suggestion about making a checklist and go over, maybe we can send out a little questionnaire and decide what people feel is most important about what's being skipped in their report, what's not being done, and, if that needs to be, did you do your bath? Even if
Right.
it's as simple as that, but if that reminds people, or going in and checking tubing and medication to make sure that it was all, you know, given at the right time, nothing's expired. If that's what we have to do, then we will make a checklist for everyone for every bedside chart and see what people think is most important. We can address at the next meeting and come up with maybe the top 10, top 15 things that need to be looked over each time the report is given.
That's really great.
Do you think it would also help if we did some kind of educational like refresher for charting or something? Like if somebody were to come into our unit and go over just the basics of charting to help refresh everyone's memory?
I think that's
On how to do
necessary,
that?
yeah.
Tiffany, what do you think about that?
I like that idea.
You like that idea as well? Good, good. Well, I appreciate you all coming, and we are going to address your concerns, and Carrie and I will have further meetings about how exactly we're going to resolve any other issues that we have in the future and how better we can actually get your opinions on how things run so we don't run into this issue anymore.
Yes, thanks, Alex. I agree. I think that this was a very efficient run meeting today. I think that we got a lot accomplished, and I want to incorporate all of our RNs more into our decision-making of the unit and how the unit is run. And I think this is the best way to go about it, is meeting once a week, making a checklist, making a suggestion box, making sure everyone's voices are heard and that people's concerns are being addressed by me and the rest of the leadership staff.
Speaking of the suggestion box, where exactly do you think actually we should put the suggestion box?
You know
Anyone
what?
have any ideas?
I do. I know a great place that we could put it. I think we should put it in the restroom.
That's absolutely disgusting. The restrooms.
It's anonymous.
The restrooms, no.
No one follows you in the
No,
bathroom.
sorry,
Harmony.
no, Paul,
Harmony.
wrong.
Everyone calm down, Harmony. We want to respect each other.
Okay, so James, you disagree with Angelia. What is your input on this?
Just due to the nature of the restrooms being not the cleanest place on earth, maybe if we had it somewhere that was safe, kind of neutral, round, maybe like our break room or something, where we can tend to, when we do sit and relax and thoughts kind of come up, where you kind of think everything, that way it's right there. So maybe if there are like pens and papers right attached to it or somewhere that's easily accessible, that way it's always just,
Okay.
Yeah, I agree.
I think that's a good idea. Well, we're all nurses. You would think that we all have clean hygiene, but break room's fine, I guess.
Well, I like both. Angelia, I do agree. We do put a lot of important information in the bathroom that we hang up there because everyone obviously goes to the bathroom. However, I do think for the sake for a box that's going to have paper and pens attached to it, I think the break area is the best place. You can be eating and write down your suggestion then you're not also taking away from patient care at the same time. You're on your break, you're writing it down, and then we don't have to conflict with the whole hygiene issue. We don't have to deal with that at all. I think that this was a very effective meeting, and we got a lot of stuff done.
Angela, I have to say I'm sorry for interrupting you.
Thanks, James. I appreciate that.
Thank you both. That was great communication. I think we established that communication is something that we needed to work on, and respect as well. As much as James interrupted Angelia, that we resolved that issue. We've resolved a lot of other issues. We're going to implement some new ideas and things to get the unit running more smoothly and keep everybody happy and on the same page. And Alex and I will do our best to keep our leadership running smoothly as well, and making sure that all of our RNs are involved in our decision making and how the unit should be run.
Awesome.
One step in the right direction.
Thank you.
Thanks, everybody.
Go team!
Go team!